we're the largest cancer and blood disorder center in the country. We're in the largest children's hospital in the country. Everyone that's here, they're here just to take care of children.
To take proper care of a child with cancer, for example, requires more than just competent pediatric cancer specialists. It requires a multidisciplinary team.
It's a team that involves nurses, social workers, other subspecialists that impact the whole child, not just their treatment of their disease, but the treatment of the whole patient, their psychosocial needs.
It's our job to help families to cope, to provide resources, to be there just to help them problem solve, and just to be a support system for them throughout the course of treatment and thereafter.
Oftentimes we'll bring our dolls out or we'll engage them in medical play to help them understand what's about to happen to them first. And also just providing a normal environment, making sure they have toys and things to do just to make the environment more friendly and more inviting and not so scary.
We provide education for our patients on multiple topics such as medication administration and how to care for their central lines at home.
We have access to all the cutting edge research here.
We have 42 different laboratories and nearly 400 people who are engaged in doing research.
We're looking at personalized therapy with all the exciting discoveries that are going on in the area of genomics, different ways to develop therapies through nanotechnologies, cellular therapies, immune-based therapies that are really cutting edge.
Our lab focuses on pediatric sarcomas. And so sarcomas are a group of tumors that we see in the kids and adolescents that usually affect bones and soft tissue. And we use a lot of the newer technologies that's out there, whether it be sequencing, whether it be protein analysis, and we apply those technologies to not only understand what's going wrong, but then why it's going wrong.
When I started, we were curing 20% of kids with cancer and losing 80%. Now we're curing over 80% of cancer and losing less than 20%. The majority of children with cancer in this world aren't in the United States or in North America. They're in the developing countries throughout the world. If you take a look at sub-Saharan Africa.
We now have programs of excellence in cancer and hematology in Botswana, Malawi, and Uganda. And Angola is a sickle cell program. When I went to Botswana in 2007, we started off in a place where the doctor really served as the nurse, pharmacist, social worker, and we've now progressed to where we have a cadre of nurses that are trained in pediatric oncology. Survival was probably at best 20, maybe 30%, and today we have an overall survival rate from pediatric cancer approaching 60%.
Our program is active in 2 of the 18 provinces in Angola. When we started work there in 2012, they did not have a clinic for children with sickle cell disease. One thing that's changed, at least in the areas where we are active, is that many babies are now diagnosed even before they develop symptoms.
Our job is not done until we cure 100% of kids and that until we're able to prevent these diseases.